Hello friends, I'm again to extend my discussion over the anatomy. We was discussing over the CNS and reach up to the medulla, and in osteology we discuss about the clavicle and humerus as well as the few aspects of the clinical anatomy also. In this order, today I am going to discuss partially the one bone that is known as scapula. Scapula. Okay, it's a flat bone which is attached behind, is articulate with the humerus bone. This bone having three border, two surfaces and three angle. That is not like long bone which having two ends, three border and three surfaces. Actually is having a upper border, having a medial border and the lateral border, three borders. The upper border, the medial border and the lateral border. This is the lateral border, slanting downward lateral border. Okay, three border, two surfaces. Look at this surface. I'm moving this surface. This is the concave surface, anterior surface. It is attached like this on the back. So this surface is costal surface, concave surface or anterior surface. Another surface, this one, where you can see this is the projection, spine is there and it itself is convex. This is known as dorsal surface. So a concave anterior surface, that is costal surface, a convex dorsal surface which is divided by this spine in upper part and lower part, two surfaces, again upper border, the medial border. And I want to tell you again, if any confusion is there, the medial border is more vertically placed and lateral border which is slanting downward and making angle with this vertical border. This is the lateral border. Okay, three border with the two surface. Now three processes. Okay, look at this and one process number one. This is the process. This process having a horizontal arm as well as a vertical arm, L shape, like this, like beak of a crow, and so this is known as coracoid process. This is known as coracoid process. Second one is this one. Okay, look at this one, which was in continuation of the spine. This is known as acromion process. Not this one. This is the spine. This part, this flattened shelf-like part is acromion process. So there is coracoid process, there is acromion process and spinous process. Okay, these are acromion process continued with the spinous process, acromion part is continued with the spinous process, and one is the glenoid process or lateral angle. This is lateral angle. Okay, this border where the superior border is meeting with the lateral border, that is known as lateral angle. Okay, so this is the lateral angle. There is the superior angle where the superior border meeting with this vertical medial border. This is known as superior angle, and where the slanting lateral border meeting with the medial border, that is known as inferior angle. Lateral angle, superior angle, inferior angle. A concave anterior surface, you should put it anterior. Now as I discussed in earlier few discussions of the osteology, if you want to study the bone, the first and foremost rule is hold it in an anatomical position. So how we are going to hold this anatomical position? Number one, the bone should be held in such a way that concave surface or costal surface should be anterior, because this is attached like this in the human body. So concave surface should be attached anteriorly with the ribs, so this should be directed anteriorly. We can't put it like this one. Okay, now first and foremost rule is costal surface or concave surface should be anteriorly posted and convex surface should be posterior. Okay, I can hold it like this? Not at all, because the inferior angle should be below and superior angle should be above, and lateral angle should be laterally placed. That glenoid, lateral angle is also known as glenoid cavity. It's a cavity which is known as glenoid cavity. This cavity articulates with the humeral bone, head of the humerus. So two things are clear: costal surface anteriorly, the dorsal surface posteriorly, lateral angle laterally, and the lateral angle or glenoid cavity should be directed laterally. Coracoid process should be direct, ideally like a pistol. The coracoid process should be directed forward and laterally, or most of the part forward and laterally. Ideally speaking, if we can see this concave surface which is attached to the costal margin is directed forward and laterally. You can see this one, okay? This lightly this. This is the position to hold the scapula. Okay, if I want to hold this in this part or in my right hand, I can't, because glenoid cavity is now toward the midline and it's a medial. Glenoid cavity and coracoid process should not be medially placed. Okay, it should be placed like this. So this scapula is or belongs to the left side. This is the scapula of the left side. Okay, so then this was the side determination of the scapula first of all, and we discuss about the superior border. Just at the root of the coracoid, from the root of the coracoid process up to the superior angle, this border is known as superior border. From the superior angle up to the inferior angle or up to the lower part of the lateral angle, this is known as medial border. And I want to tell you again, the medial border is vertically placed. Many of the students committed the mistake that they consider it a lateral border, or not at all. Lateral border is a cord-like border which is slanting from the glenoid, subglenoid area, and this is slanting and meeting at the inferior angle with the vertical or medial border. Okay, three processes and two surfaces. This bone is known as scapula. Okay, now before moving to any of the border surfaces attachment, I want to discuss first of all three processes. Let's discuss about this process. Okay, can you memorize this one? Okay, the humerus is articulating this one, this forming the shoulder joint. Okay, this forming the shoulder joint with the humerus. The humerus bone is articulated with this one. Okay, this humerus bone is forming shoulder joint, but you can see this is a very shallow cavity. This shallow cavity and head of the humerus is almost 2/3 to 3/4 of a sphere. Easily dislocation can occur this way. Actually, shoulder joint is one of the most vulnerable joint for the dislocation. Okay, because it's high mobility. Mobility is more. Movements are more on the shoulder joint. So chances of dislocation of the shoulder joint are more. But few other factors which are contributing to making it prone toward the dislocation is this shallow glenoid comma-shaped cavity, that is the glenoid cavity. So what nature provides us? A glassy cartilage is attached on the margin of this glenoid cavity, that is known as glenoid labrum. Glassy cartilage which is grooving it more. Okay, this cartilage is known as glenoid labrum. Okay, if this joint is more vulnerable for dislocation, nature provide us more protection, and that is the glenoid labrum. Not only the glenoid labrum, several other protective measures are also there, which is known as rotator cuff, etc. You should read about the rotator cuff, which is a very important short note. Dislocation of shoulder joint is not an uncommon phenomena. So the factor which is contributing that making it prone for the dislocation is narrow or shallow glenoid cavity and large sphere of the humerus. And what nature provides us? The glenoid labrum, which is attached with the margin of this one, that is glenoid labrum, that is a cartilaginous cuff around this glenoid cavity. Not only that, if you can see this one and elevating this one, here is the supraglenoid tubercle. Here is the supraglenoid tubercle. Here is the supraglenoid tubercle. And not only that, where the lateral border is meeting with this glenoid cavity, there is an infraglenoid tubercle. The supraglenoid tubercle as well as the infraglenoid tubercle. From the supraglenoid tubercle, there is attachment of the long head of bicep brachii. Bicep brachii is this muscle. This muscle is bicep brachii. And bicep having two heads. Okay, one head we find out. This is arising from the supraglenoid tubercle, that is a long head. Whereas short head, we will discuss. And short head is also arising from the scapula. I want to tell you again an interesting fact. I think I discussed this one in humerus. That bicep is the muscle which passes in front of the humerus but never ever attached in the humerus. Is arising from the scapula and attached on the radius bone. Okay, interesting. It is the major muscle of the arm but is not attached with the bone of the arm. Okay, so this is the supraglenoid tubercle having the origin of the long head of the attachment of the long head of bicep brachii. Okay, very easy to learn. Infraglenoid tubercle give rise to long head of tricep brachii. Again, I want to clarify two things. Whenever you are talking bicep, never say bicep, because bicep brachii is a full term. Brachii means the arm. And if you are saying that bicep only, there is bicep femoris also, which is found in somewhere in the lower limb. So complete name is bicep brachii. Bicep means two head, and one head is arising from this area. Long head is arising from the supraglenoid tubercle, and the long head of the tricep, which is having a three head and extensor muscle of arm, is one head is arising, long head is arising from this one. Both glenoid tubercle give rise to the long head only. Upper one, supraglenoid tubercle, long head of bicep brachii. Infraglenoid tubercle, the long head of the tricep brachii. Glenoid cavity, glenoid labrum. Okay, so I am ending this process which is known as glenoid process. Now coming toward this coracoid process, which is almost L shape. This is L shape. Okay, if I am putting like this, like my finger, this is like this, a vertical arm, a horizontal arm. This is the coracoid process, and there is the several attachment. Initially, the coracoid process is supposed to be a atavistic type of epiphysis, a bone which was initially developed different from this scapula, and then in a later stage of life, this fuses with the scapula. Such kind of epiphysis is known as atavistic epiphysis, and this coracoid process is classical example of the atavistic epiphysis. Now, important question which is frequently asked. If an examiner is asking you to hold the scapula, number one, what he or she wants, hold the scapula in an anatomical position. Number two, identify the borders and angle, and very important and very frequently asked question, the coracoid process. What structure attached with the coracoid process? Okay, one, the lost origin of the bicep brachii. One head was arising from the supraglenoid, another very near to this one, that is short head of the bicep brachii is arising from this coracoid process. Okay, look at my two fingers, one is arising from the supraglenoid, another is arising from the coracoid process, and both working as a bicep brachii. So coracoid process give rise to the short head of the bicep brachii. No confusion, supraglenoid tubercle, long head of the bicep brachii, and the coracoid process, short head of the bicep brachii. One more muscle which is arising from the coracoid process and attached in the medial medial of the arm on the humerus, that is known as Coraco brachialis. Is self term. Coraco means coracoid process, brachium means arm. Going from the coracoid process, attached in the brachium, especially in the medial side, Coraco brachialis. Two muscle confirmed from the coracoid process. One is the short head of the bicep brachii, and second one is the Coraco brachialis. Third muscle which is attached on the medial border. The medial border of the coracoid process. Medial border of the coracoid process. If I want to mark this one, this is actually inserted, and I want to give you a hint. This is a muscle which is arising from 3 to 5 rib, running like this and attached here. This muscle is a key muscle of the pectoral region. This is dividing the axillary artery into 3 parts. This is pectoralis minor. Pectoralis minor. So third muscle is the pectoralis minor. Coracoid process is atavistic type of epiphysis. Coracobrachialis and bicep brachia attach with this one. Pectoralis minor is attached on the medial border of this coracoid process. Okay, three muscle attach on the coracoid process. Okay, now usually the student be silent over there. That is, some students are telling two muscles, some are telling three muscles. I want to tell you again, is having three very important ligament. One is this one. Look at my finger. Look at this one. One is arising and attached like this one, and this is from coracoid process to the acromion process. Show that if the humeral head is want to dislocate, this ligament is hampering. Again, this ligament is hampering upward dislocation of the humerus from the coracoid to the acromion process. This is ligament like this, and so they look at this one. This is forming an arch. Actually, from the coracoid process to acromion process, this is forming arch, and so it is hampering the upper dislocation. This ligament is known as coracoacromion ligament. Coracoacromion ligament. Second one is very important ligament when we discuss about the clavicle. Inferior surface of lateral aspect of the clavicle having a conoid process and conoid process, as well as the trapezoid process. Both processes are there. This having the attachment that is known as coracoclavicular ligament. Coracoclavicular ligament. So another ligament is coracoclavicular ligament. And third, very important one, that is attached with the humerus and again hampering inferior dislocation of the humerus from the coracoid process up to humerus, that is known as coracohumeral ligament. Coracohumeral ligament. Okay, three ligaments: coracoacromion ligament, coracoclavicular ligament having two components, conoid and the trapezoid, and third one is the coracohumeral ligament. Three muscles, three ligament is attached on this coracoid process. Coracoid process. Okay, we discussed about the coracoid process. Now this is the spinous process. We can look this spinous process. Okay, look at this one on a dorsal surface, posterior surface. This spinous process having a posterior border. Okay, this is posterior, this is toward you, but I am reflecting this one. Actually it is a posterior border. This is the posterior border, and an anterior border which is merged into the dorsal surface of the scapula. You can't see the anterior border because anterior border is merged into the scapula. Okay, and there is the lateral border which is forming a notch with the glenoid cavity, that is known as sphenoglenoid notch. Sphenoglenoid notch. This notch passes through the artery, the suprascapular artery. Okay, and suprascapular artery is traversing through this one. So there is, this one is a lateral border, this one is a posterior border, and anterior border is merging with the dorsal surface of scapula. Not only that, look at this posterior border. The posterior border is actually broad. It's having an upper lip. This is the upper lip of the, this is the upper lip of this posterior border, and here is the inferior or lower lip. So posterior border having two lip, upper lip and the lower lip. Not only that, the lower lip is continue with the lateral surface of the acromion process. Upper lip is continuous with the medial border of the acromion process. The lower lip is continue with the lateral border of the acromion process, and the medial border is continue with the upper border of the upper lip of the posterior surface, posterior border of the scapula. Okay. Now look at here. This acromion process is communicating with the clavicle. From the lower lip, lateral border of the acromion process and the anterior aspect of the clavicle give rise to a muscle. Okay, look at my shoulder. This muscle is arising like this, and this is known as deltoid muscle. Deltoid muscle is arising from the lower lip of posterior border, as well as it continue and the arising from the lateral part or lateral border of the acromion process. Important aspect is that only this part of the acromion process give rise to the multipinnate fiber of that muscle, and this muscle is known as deltoid muscle. Deltoid muscle, okay? The upper border and medial border of the acromion muscle having the attachment of the trapezius. And if you can articulate the clavicle with this one, you can assess why the posterior border of the lateral 1/3 of clavicle is continued with the trapezius and anterior border give rise to the deltoid. So this is something about the acromion process, spinous process, coracoid process and glenoid cavity, and how to hold the scapula in anatomical position. Next is we having the borders. There is a borders and there is the surfaces. In next session of this osteology, I will definitely discuss the further attachment of the scapula. But the core part of the scapula is glenoid cavity, and what are the factors stabilizing the glenohumeral junction, and what are the factors which are destabilizing this one. Coracoid process. If you are having a scapula in your hand, a very good examiner always asks you about the coracoid process. So remember about the coracoid process. We talk about the coracoid process, acromion process and the glenoid cavity. In next session, I will discuss the border surface and attachment of the scapula. Thanks for the patience for hearing, and I will try to be continue with the fast speed in the anatomy. Thank you, friends.